Hello and welcome to Medicare Made Easy. This is a production of Blue Cross and Blue Shield of Louisiana, designed specifically to help people as they're turning 65 and beyond understand the Medicare program and use it to the best of their ability. You know, it's a new year, and if you selected a Medicare plan for 2024, your benefits and your plan began on January 1st. So we want to talk a little bit today about making the most of your coverage, making sure that you're getting all you can get out of your Medicare Advantage plan during 2024. I'm Mike Berto. I'm a healthcare economist with Blue Cross and Blue Shield of Louisiana. And joining me today is my good friend Tress Faraday, an expert on Medicare Advantage.
So hi, Mike. Thanks for having me. So I work on the Medicare sales team at Blue Cross, and at the beginning of the year, lots of questions. Folks may be an existing member or a new member, and as you mentioned, your plan started on January 1. So what we find one of the greatest things to do as a member for your health plan is to sign up for your member portal. So you can go on your health plan's website and go to the member area and register, because there's a wealth of information there. You can look up your claims, you can get information, you can anything really, know more about your benefits. So there is a document that I love. It's called the Summary of Benefits, and it's exactly what it says. It's a summary. It's kind of in a grid, and it has your benefit and what, if you have a $0 copay or if there was a copay, et cetera. So it's a great quick reference to kind of determine, okay, what are my benefits on this plan? Am I leveraging them? So really, if going to that member portal, registering, also in January, chances are your health plan will send you some mailers. You probably want to open them and read them, because it's probably giving you guidance of like, hey, you know, here's where our member portal is. Here's where these documents are. If you want to find out if a doctor's in network, this is where you would go. So really those documents are kind of going to guide you where you need to be. And there's a ton of online resources, whether it's on a computer or on your phone or what have you, that you can leverage quickly, check where you are, and just making sure you're making the most of your benefits.
You know, you're bringing up a very important point. When you're using a Medicare Advantage plan especially, it's critical that you use doctors and hospitals that are in your network, because the difference in your cost, your out-of-pocket cost, can be pretty dramatic if you're not using an in-network doc or an in-network hospital or facility. It's also important to check the prescriptions that you're already on and how your new plan will cover those prescriptions. Very important to make sure you understand your copays and your rights under the plan. It may be that there's a medication out there that will do the same thing for you that's less expensive under your plan. Be sure to check with your doctor. Make sure your physician is aware that you want to take a look at that so they can check for side effects or any other problems that may come along. You know, every year you want to make sure that you have your wellness visit, right, which is covered by your plan. People tell me all the time, and I'm the same way, all of a sudden it's June and I haven't been to the doctor and I just forget. It's a good idea to pick out a milestone every year to help remind you to do these things, like your anniversary maybe, or your birthday, just to kind of focus you in on one particular day that you know you'll remember to get that annual visit, to stay on top of your numbers, your blood pressure, your cholesterol, your blood glucose levels. All of these things that can lead to long-term health problems, we want to make sure that those things stay under control. Reach out to your healthcare provider. If you have a GP, reach out to them early in the year and make that appointment so that you know you'll get your annual checkup and all of your screenings. Also, there's some other stuff going on when you go to that annual checkup, right?
Right. So there's a lot to unpack from what you just said of the in-network doctors to tout, the Blue Cross Medicare plan. We have over 12,000 doctors in our Louisiana network. Wow. And over 100 hospitals. So tons of options there. You want to choose a primary care provider. So that's the doctor that'll get to know you and kind of track your screenings, because they may say, look, there's certain screenings that you really need, things we need to be matching up. They might suggest some vaccines for you, and I'm with you on how I do it. I liked how you said an anniversary or birthday, kind of use a milestone to track you. I think about like spring, summer, fall, like what am I going to get done in the spring, what over the summer, what over the fall, because sometimes your schedule's a little different depending on those seasons. Like a flu shot, you want to get your flu shot before the end of October, right? So that's more of a fall activity, but maybe, your doctor's going to recommend some other vaccines that you need to be thinking about. So I think that's something to really think about. There's also like colonoscopies. Maybe it's time for your colonoscopy. It's easy to kind of lose track of your time if you're on a 5-year plan or a 10-year plan, and your doctor can help track that. Mammograms, is it time for you women to kind of do your mammogram? So those are things your doctor can kind of help you just keep up with. Don't miss the dates. Make sure it happens, because what you don't want to do is it's November and you're like, oh no, you're trying to get everything done right at the end of the year. So you talked about annual wellness. So we just want to make sure, all of our members stay healthy, leverage their benefits, because we want to be proactive. We want to kind of help them not get sick.
Absolutely. And to those of you who are going to turn 65 in 2024, happy birthday. I just want to let you know this is a great event for you, because once you're turning 65, you'll have that opportunity perhaps to sign up for Medicare for the first time. Chess, can you kind of lead us through that process? Tell us a little bit what it's like when you're signing up for the first time.
So, I get a lot of questions. People come to me and ask, and even when they're not even kind of Medicare eligible yet, lots of folks are prepping like a year in advance, because it can be tied around when you're going to retire, and timing of retirement, finances, etc., goals, that kind of thing. So they kind of run hand in hand. So kind of thinking about it early, planning your dates early is a great idea. One great thing to know is, does your employer or your spouse's employer offer group retiree coverage or not? So the question is, when you or your spouse retire, can you still get healthcare coverage through the employer? Yes or no? Some entities offer that, some do not. So, because sometimes people will come and ask me about Medicare, and the first thing I ask is, do you have access to group retiree coverage? They're like, I don't know. Okay, so I'm like, go find that out. And if the answer is you do, their open enrollment dates, their timing, that employer, you would kind of want to get all your information and guidance from them. They would determine the dates for open enrollment. They would determine timing, things like that. If the answer is you don't have that option, that means you're going to pursue individual Medicare coverage on your own. So when you're turning 65, there's a 7-month window to enroll. So it's your birthday month, the 3 months before, and the 3 months after. So that's your 7-month initial enrollment period. So what you can do is kind of track that on the calendar, know when that's going to happen, and kind of plan when you're going to do that. Now, the question is, are you going to keep working or you're going to retire? So you want to make sure you're real clear on that and real clear on those dates, because that would help impact it. And what I find, if you're going to pursue individual Medicare coverage, talking to a licensed agent is really great. There's no obligation, there's no cost. Just ask questions, make sure you get your dates right. So we have, licensed agents at Blue Cross, and they are licensed to the Louisiana, Department of Insurance. They also get an annual Medicare certification. So they literally, every question of Medicare you could ever think of, they've answered it. They have the info. So you could call the number, get in touch with them and ask your questions, start kind of figuring out your timing, figuring out what you're going to do, because you want to make a good choice. You want to choose a plan that's a great fit for you, gives you the benefits you need, fits your lifestyle. So you really want to kind of leverage someone who has the Medicare answers you're looking for.
And I find it's very valuable when you go into this process to have kind of a clear understanding of what Medicare really is. 3 insurance plans, 4 insurance plans, not just one. It's a bit of an alphabet soup.
Yes.
So the first thing that you hear about when you talk about Medicare is Medicare Part A. Part A is hospital coverage, and you earn Part A during your lifetime when you're working. If you work 40 quarters, paying the Medicare taxes during your lifetime, you get your Medicare Part A hospital coverage at no cost, no premiums for you. It's got a deductible, and it has copays after about 60 days in the hospital, but it's excellent coverage. The second part is Part B. And the Part B program covers things like your doctor visits or ambulance rides or ambulatory surgery. So you want to make sure that you enroll in Part B as well. We also have Medicare Part C. You'll hear us talk about Medicare Advantage quite a bit. That's Part C. It's a nice product because it combines all of the aspects of Part A and B into one insurance plan administered by private insurance companies like a Blue Cross plan. And then you can also roll Medicare Part D into that, which is your drug coverage. So you can have all of the coverage in one plan, all in one place. This has turned out to be very valuable for folks I read yesterday over 30 million people in the United States now have enrolled in an MA plan to combine all of those things together. And I thought you did an amazing job of explaining what happens if you're going to keep working. More and more of us nowadays are not just throwing in the towel at 65, right? So it's important. I think the most important thing you said was work through your human resources folks. If you don't have human resources folks, if you work for a small company or you're an independent, it's a good idea to hook up with agents, right? The agents and consultants that we talk about are really well versed in this information. It doesn't cost anything to use a licensed agent with us, and you're under no obligation to buy. But they've got a lot of information already about how this stuff works. You don't have to go through that minefield alone.
Right. They hear the alphabet soup and it gets a little overwhelming, because especially if you've been working and on a group plan, your employer kind of chose your plan, and now you're kind of feel like you're out on your own. The good news, you're not. You can call a licensed agent. They can kind of guide you through it, make sure you get your right timing, make sure everything's going to make sense for you. Depending on your healthcare needs, like, can you get your care close to home? So you may want an HMO network that has a more narrow network, and you save some costs. Or maybe you split your time and you travel, so maybe a PPO plan would make more sense with you with a nationwide network. And so a licensed agent can kind of explain those things, because you say, look, I get my care close to home. What are my options? I want to save money. They're going to give you some options. You say, look, I split my time. I go visit grandkids. I do this. I travel a lot. Then they're going to give you a different option, because what you don't want to do. We talked at the top of this of out of network. You don't want to go out of network, right? Your goal is to not go out of network, because you can see unexpected charges. So kind of understanding your doctor network and who you can see and when you can see them is real important, because what you don't want to do is you unexpectedly get sick and suddenly, yes, you can see this doctor, but there's unexpected charges. So a licensed agent can kind of walk you through this, make sure you're safe, make sure you have the right setup for your life and kind of the needs that, really you require for how you're living your life and how you're staying home or traveling.
I also want to point out that the agents that we use, that network of people, their help doesn't end the day you sign the papers.
Correct.
Right?
Yeah.
They're there all year round. They're going to make sure that you get your questions answered. And they know this business because they've been through an enormous amount of training and licensing. So they're really good at it. In fact, if you're turning 65 this year, I would strongly encourage you to use an agent to help you guide through this process. Now, here's some information we're going to put on the screen so you can put a face to whom you'll be speaking to when you start looking for an agent to help you. I just want to thank everyone for joining us today. We're at the end of our time, and Tress, amazing co-host as always. It's so nice in a program like this to have someone who's so well-versed in the subject matter. You just knocked it out of the park again. So I want to say thanks. If you'd like more tips and videos about Medicare enrollment and how to pick a plan, I'd encourage you to take a look at our YouTube channel, BCBSLA. It's all there and it's ready for you to view whenever you want. Don't forget, the agents are available all year round, and feel free to reach out to us whenever we can help. Tress Faraday, Mike Berto from Blue Cross, thanks for joining us today.